First aid. Introduction. First aid is the immediate assistance or treatment given to someone before the arrival of medical help, ambulance, or EMS, that is emergency medical service. Qualities of a first aider. Observant, notice all signs. Resourceful, make best use of all things. Gentle, shouldn't cause pain. Tactful, shouldn't be alarming. Sympathetic, should be comforting. Protecting yourself as a first aider. Avoid contact with blood and other body fluids or objects that may be soiled with blood and other body fluids. Use protective CPR breathing barriers. Use barriers such as disposable gloves between the person's blood or body fluids and yourself. Before putting on personal protective equipments PPE such as disposable gloves, cover any of your own cuts, scraps or sores with a bandage. Do not eat, drink or touch your mouth, nose or eyes when giving care or before you wash your hands. Avoid handling any of your personal items such as pens or combs while giving care or before you wash your hands. Do not touch objects that may be soiled with blood or other body fluids. Wash your hands thoroughly with soap and warm running water when you have finished giving care, even if you wore disposable gloves. Alcohol-based hand sanitizers allow you to clean your hand when soap and water are not readily available and your hands are not visibly soiled. Tell EMS personnel at the scene or your healthcare provider if you have come into contact with an injured or ill person's body fluids. If an exposure occurs, don't forget reporting the incident and follow up, that is post-exposure evaluation. Aims of first aid. 4 P's. Preserve life, protect unconscious, prevent injuries, condition from worsening, promote recovery. Preserving life. Control bleeding, treat probable cause of shock, maintain airway in correct position, perform CPR when needed, when there is no breathing or pulse. Protect unconscious, remove from danger, assess condition, maintain airway patency, recovery position if condition permits. Prevent condition from worsening, dress wound to prevent infection, provide comfort to casualty, Place casualty in a comfortable position. Promote recovery. Relieve casualty from anxiety. Encourage confidence and trust. Attempt to relieve pain and discomfort. Handle casualty gently. Protect casualty from cold and wet. Why don't we do first aid when someone needs it? Uncertain about victim, fear of disease, presence of bystanders, uncertain about type or extent of injury or illness, fear of doing something wrong, shock or being upset, fear of doing more harm, fear of legal liability, negative attitude towards stranger or a particular group, social norms that do not emphasize helping strangers or the opposite gender. Golden rules of first aid. Reach the site of accident as early as possible. Do not waste time asking unnecessary questions. Find out the cause of injury. Separate the causative agent from the patient or the patient from the agent, for example, falling machinery, fire, electrical wire, poisonous insects, etc. Find out whether the patient is dead or alive, conscious or unconscious. Determine the priority of first aid measures to be adapted as restoration of cardiac function, restoration of breathing, stop bleeding from the site of injury, etc. in that order. Arrange for medical help. Keep a record of patient and the details of the event. Keep the patient warm and comfortable as far as possible. Improvise rather than wait for specific equipment. If the patient is conscious, reassure him. Early transportation of patient. Important things to remember when calling for help. State which emergency service you want as ambulance, coast guard, rescue, fire, disaster or police. Stay on the line until connected with the emergency service operator, as they will need to talk to you before sending assistance. Give as much information as you can about the emergency, including exact address or location, any landmark, distance from the town or landmark, caller's name, phone number from where the call is being made, what happened as car accident, etc. Chain of survival has the following steps in this particular order: call for help, early resuscitation, external defibrillation, advanced emergency medical care. 7 essential first aid interventions. Call for ambulance. Do not allow movement unnecessarily, perform chin lift or head tilt chin lift, mouth to mouth breathing, especially in children, drowning or poisoning, chest compression, operate an AED, that is automated external defibrillator, stop any bleeding. Emergency hotline numbers: ambulance 102, police number 100, fire brigade 101, emergency response service 108.